What do you do when you've had hernia surgery and the hernia is fixed, but the pain didn't go away? Today, I want to walk you through a real case from our clinic. A patient who tried almost everything for nerve pain after a hernia repair and what finally worked for him. This patient came to us in his early 30s. A couple of years earlier, he'd had an inguinal hernia repair with mesh. The hernia itself was never the issue again, but ever since that surgery, he'd had sharp, burning pain in his right groin. It radiated down his thigh to his knee and into his scrotum. This wasn't just uncomfortable, it affected his ability to be physically active, and sometimes it made urination difficult. Even worse, it affected his ability to be intimate with his new wife. He'd tried steroid injections and they helped, but only for a week or two at a time. He saw a pain specialist who tried a treatment called prolotherapy. That one actually made things worse. He tried nerve blocks with local anesthetic and steroid, but still only temporary relief. By the time he found us, he was looking for other options, and he'd heard about regenerative medicine, so he called LifeStem. On exam, his surgical scar looked normal, just a little thickened, and the area was kind of tender. We did an ultrasound of the inguinal region, and the hernia repair itself looked intact. No recurrence, normal spermatic cord and vessels, but we couldn't clearly separate the inguinal nerve from the spermatic cord on the imaging, which is actually a common finding when that nerve has become irritated or scarred down after surgery. Putting his history and exam together, the diagnosis was ilioinguinal neuritis, or entrapment or irritation of the ilioinguinal nerve, which is a common complication after inguinal hernia repairs. Our plan was an ultrasound-guided ilioinguinal nerve hydrodissection, followed by an injection of platelet-rich plasma made from the patient's own blood into the inguinal canal. Hydrodissection uses fluid injected under ultrasound guidance to gently separate a nerve from surrounding tissue that it may be stuck or scarred down to. The idea is to free the nerve mechanically, then deliver an injection of anti-inflammatory proteins and growth factors from your own body into that newly created space. We talked through the risks, bleeding, infection, possible nerve or spermatic cord injury, and the chance that the pain could persist. He decided to move forward. After the procedure, his pain resolved, and he no longer had trouble being intimate with his wife. For someone who had been dealing with daily, activity-limiting pain for years, despite multiple other treatments, that's a very significant outcome. And here's the part that stuck with our whole team. Less than a year later, he sent us pictures of his newborn daughter. He's back to living his life, and we are ecstatic that we got to be part of that story. Every patient's situation is different, and not everyone responds to treatment the same way. This is one case, not a guarantee of results. But if you're dealing with chronic pain after hernia surgery and you feel like you've run out of options, it's worth getting evaluated for nerve involvement. Look below for a link to book a consult, and thanks for watching. This video, by the way, is for educational purposes only and does not constitute medical advice. Individual results can vary. Platelet lysate, platelet-rich plasma, and hydrodissection are performed as part of an individualized treatment plan following clinical evaluation.